if we map these out, we can see that there are sources of supports that are, first of all, service-based supports, and those would include the ones that are resource draining or resource required. But natural supports can occur from the person themselves, from their family, from their friends, from informal supports, for example, on the work setting, and from generic services. So individuals don't necessarily need to have specialized services, but they need to have access to those supports that are necessary for them to be able to function most fully in the environment. This, by the way, was our fishing tournament from the SANS project, where we provide trophies for our individuals from Omaha Public Schools and the Millard Public Schools. So Dave, our coordinator here, got a little carried away. Everybody got a trophy. A survey was done by the Center for Medicaid and Medicare Services, and the participant experience survey includes items relating to choice and control. Do program participants have input in the type of services they receive? In the past, it was much more, we're going to support you, we're going to tell you what you need, and you in turn don't have much of a voice in that. This is changing. This is changing dramatically, and individuals now have input into what services they can receive or ask for. Our programs participants treated with respect by providers. Okay, this has been a major concern in the past related to abuse or to making fun of individuals. Access to care. Our program participants' needs for personal assistance, adaptive equipment, and case management services being met. And then finally, do program participants participate in activities and events outside of their homes when they want to and of their own choosing? Okay, and these again are major changes in how we think about supports and services for persons with disabilities. They've really just occurred primarily in the last 20 years. What are the outcomes we're looking for? Well, one of the big programs has been money follows the person, meaning that instead of funds basically going to programs, the person is allocated a certain number of hours of service or supports and the resources to provide those. And that involves, and then the outcome for that is successful placement out of an institution, improved well-being of the individual, enhanced choice-making, and then increased community participation. The second part of the request for me today was to talk about where are people with intellectual disabilities. And I'm just going to talk about the Nebraska experience as well as some of the national data on this. 50 years ago in Nebraska, you went to the Beatrice, time was called the Beatrice Home or Beatrice State Home. And at that point in time, I happened to have a cousin with Down syndrome, and his mother got sick, and he came to live with us for about 6 months. And then I remember the social worker picked him up, and he was, I think, just turned 2, and took him to the Beatrice State Home, where he was in residence for almost 30 years. Nebraska State Home actually started in 1887 as the Nebraska Institution for Feeble-Minded Youth, and it was established in rural Nebraska, in southeast Nebraska, in Beatrice, Nebraska. And prior to 1968, people with intellectual disabilities, such as my cousin, Denny Pat, were placed in the Beatrice State Home, and that's where it was felt that they would be served best. Built for 800, the facility expanded to a population of over 2,300, and some of the conditions, frankly, were atrocious in that era. Daily expenses per person at that time were $4.70, just above the usual rock bottom state of Mississippi and South Carolina. Children placed at BSDC had a 50% death rate in the first 12 months that they were there. And this was in the 1950s. Now, there'd been enough medical progress by the 50s that shouldn't have happened, okay? But it did. And actually, the There was actually a worsening of the statistic during the 1950s as compared to the 30s and 40s, where the death rate was 30 to 40%. It actually increased in the 1950s. Going back to the community required forced sterilization, and that law was in effect in the state between 1917 and 1963. There was a report on eugenics, and in Nebraska, 902 individuals, the vast majority of whom were from the Beatrice State Home, were actually forced into sterilization if they wanted to leave the facility. So you had a choice. You could stay and live the remainder of your life at DSDC, but if you wanted to go back to the community, your family wanted back, and again, as late as 1963, you had to undergo sterilization. Major changes, and obviously in the 1960s with the Kennedy administration and the Developmental Disabilities Act, there was a huge change in concept, policy, and thought about working with individuals with intellectual disabilities. In Nebraska, our paradigm shift started in 1968, and actually it's very interesting that it started almost exactly where you're sitting. The Nebraska Psychiatric Institute had the building that was located right here in this facility, and there were a number of movers and shakers that would meet regularly and plot out strategies for how we can change the system in Nebraska, including Frank Mendelacino, Wolf Wolfensberger, etc. Excuse me. There was at that time, the governor appointed a citizens study committee on mental retardation to look at the Beatrice State Home. And this was done by not only the Citizens Commission, but also the Nebraska Association for Retarded Children, at that time as it was called, and then it changed later on to the Association for Retarded Citizens. Like almost all states where major changes have occurred, there was a lawsuit, and our watershed lawsuit was Horacek versus Exxon, and it has various dates on it. But because it initially was Horacek versus Thone, the other governor, but this particular case goes back to 1972, and that's when a lot of the sweeping reforms were initiated, as well as funding for persons with developmental disabilities in the community. Nebraska consequently was one of the very first states to implement community-based services. At one point in time, almost a third of the state directors for developmental disabilities and mental retardation in the country were actually from Nebraska, and actually had worked, most of them, with NCORE. I talk about the NCORE experiment. NCORE was the Eastern Nebraska Community Office on Retardation, and it began again in the 1960s, late 60s, early 70s, and was a model for the country. The model obviously has changed over time, and we really want to keep up with the changes in the model. And today, we have over 4,100 individuals with developmental disabilities and intellectual disabilities on community waiver services in the state, across the state. We have 6 different regions and something like 47 different sub-programs that are serving individuals with developmental disabilities and intellectual disabilities. The Beatrice State Development Center has decreased its population to approximately 190 at this point in time. We still have a significant waiting list. In 2008, there were over 1,700 individuals on a waiting list for services. In 2008, the Nebraska legislature finally got to the point where they started addressing the waiting list problem, and they've actually allocated over a couple of year period of time $30 million to assist individuals with intellectual disabilities in obtaining supports who were on the waiting list, and actually addressing people who've been on the longest, because many times people would get bypassed, so there were some questionable decision making in terms of who was actually able to get services. So, where are people with intellectual disabilities living today? Well, there's a whole number of folks who are living independently. There are a number of individuals who are living at home with their parents with family support. There are individuals living with relatives. There are individuals living in group homes, in supported apartments and houses, living with home teachers, which is a concept of of I have a family and we're going to invite you into our family to be a part of our family, in intermediate care facilities, in institutions, and also on waiting lists. So this is where individuals are. This is not just in Omaha. This is not just in Nebraska. This is the nationwide issue. Living with families, okay. This person probably would, several decades ago, been shipped to the Beatrice State Development Center. Now this person is able to live effectively at home with families and receive an appropriate educational program. Living in homes and apartments or group homes is another option for families at this point in time, and living independently with supports, for example, accessible transportation in the family. So overall, the goal of assessment, as well as defining individuals with disabilities, is full participation, acceptance, and integration of persons with disabilities into all of society. And I want to kind of stop here because this is I think the key for running assessments and classifying individuals. But the long-range goal is to have individuals provided with the services and supports that they need in order to become fully involved in their communities.